This is WCN, the Whole Care Network. You talk, we listen. Content presented on the following podcast is for information purposes only. Views and opinions expressed during this podcast are solely those of the individuals involved and do not necessarily represent views of the Whole Care Network. Always consult your physician for medical and fitness advice, and always consult your attorney for legal advice. And thank you for listening to the Whole Care Network.
Have you ever met anybody that has caregiving on their bucket list of things to do in life?
Beyond caregiving, how do we care?
We also have to care for ourselves.
How do we treat friends, family, strangers we meet?
Forget it.
How do we heal? The physical, social, financial, spiritual.
Hello.
By creating healing ties. Tying it all together like a bow tie. With your host, Christopher McClellan, the bow tie guy.
Well, greetings, everyone. It is Christopher McClellan. You might know me as the bow tie guy, and welcome to another episode of Healing Ties featured on the Whole Care Network. On the Whole Care Network, we are all about story sharing and resources because we believe it's through story sharing where diversity meets the road to collaborate on a common cause. And our common cause is supporting caregivers before, during, and after caregiving ends. And as you know, we're celebrating National Family Caregivers Month with the reboot of the popular Healing Ties podcast. Well, I think it's popular, with our 30 podcasts in 30 days to celebrate National Family Caregivers Month. And just as important, the soft launch of our new Whole Care Network website. So when you get a chance, please visit our new site at wholecarenetwork.com. Well, you've got to go to the old site to get to the new site, but the link to the new site is right there. You'll figure it out. And then when you get to the new site, you'll meet a fellow by the name of Bo, because Bo ties things together on the Whole Care Network. As soon as you see Bo, you'll get it 100%. And during our soft launch, we are asking our listeners to provide us with feedback on the new site so we can continue to build our site where you can easily find your favorite podcasts, favorite blogs, and videos. Oh, and by the way, you'll be able to search content on the Whole Care Network via 4 categories. That's our 4 pillars of care: our physical, social, financial, and spiritual health. And be on the lookout for our new YouTube channel featuring live shows, our streaming 24/7 radio station, and a few other changes coming to the Whole Care Network in 2021. Well, enough from me. My guest for this episode of Healing Ties is the Vice President of Marketing for Caremerge, Josh Studzinski. Josh has spent the last 10 years in business-to-business technology organization, driving growth through marketing, demand generation, and digital transformation. He currently leads the marketing, branding, and event strategy at Caremerge, and I am excited to welcome Josh and learn about technology at Caremerge. Josh, thanks for joining me today.
Thanks for having me. This is really exciting. Thanks so much. I appreciate it.
Yeah, so first questions first. How did I do on your last name? Because I'm very self-conscious about last names because mine's a hard one too.
That was good. You nailed it. Took a couple times in the beginning to get it right, but we're on it now.
We're on it now. Well, it's just from here on out, it's Josh. So
that works for me.
Yeah. So I've had the privilege of reading a little bit of your bio and background, and I know a little bit about Caremerge, and I love what you're doing, but let our listeners know a little bit more about you, and let's dig into the conversation.
Sure, that sounds great. So Caremerge has been around for about 8 years, and we provide engagement and clinical technology to senior living communities. And we're doing that at almost close to about 500 communities across the United States.
Awesome.
Yeah, it's great. It makes a big impact, not just on communities themselves, but the caregivers, like you brought up in the beginning.
Right.
And we provide engagement, which is helping staff to operate more efficiently, for family members to stay in touch with their loved ones and know that the level of care that they are accustomed to is happening, and for residents to stay engaged, especially during this time where people are going into lockdown and don't get to see their loved ones. How do they stay well? How do they stay happy? How do they stay engaged with each other, right? It's a huge issue. Social isolation is such a problem. So we're trying to address those issues. And then we also provide a clinical solution to make sure we're tracking the health and wellness of residents too. So whether that's medications, tracking their health, making sure they're assessed properly, and making sure that the staff have the technology to do that. So we provide one easy to use platform for senior living communities to do what I just talked about.
So you're dealing with the technology is dealing with all the issues that are going on with COVID,
Yep.
while balancing on the medical side and the socialization side. That's amazing.
Yeah, it's a lot. And when this pandemic started to hit, really in March, we came together as a management team to talk about, what could we do to really make an impact and help communities during this time. So we actually, we have a solution called Broadcast. It's really just a mass communication tool, if you think about it.
I like broadcast now,
Yeah,
so
exactly.
I want to learn more.
It was great. So it's a quick message system to send to residents, families, and staff. We didn't commercialize it, so it wasn't something that was open to our communities, but we actually ran a quick process on our product team, QA, and launched it again in about 24 hours and gave it away to all of our clients for free. So within that, in about a week's time, we had about 350 communities up and using it. We almost sent about 1 million messages within about 6 weeks. So the changes organizationally and visitation, it was fantastic to see the usage and the helpfulness for these communities.
I'm always amazed. I self-revealing. I'm 63. I'm at that stage where I know enough about technology to know when I need to ask for some help.
Mm-hmm.
But as I look back in my caregiving experience, which was, we're 6 years past being in caregiving, and I see all the advances in technology.
Yep.
And how that is not only helping the caregiver, but the staff and the family. Everybody seems to be a little bit more engaged.
Yes, definitely. And, I think technology, it just helps facilitate those conversations that might have happened over a phone when people are going back and forth on voicemail. So how do you get updates, whether it's, is mom being active today? Is she going to lunch in the small group formats that they're opening up with at some communities? Like, to know those things opposed to picking up the phone when you could just send a simple message through an application and get that notification on what's going on with your mom. Like, it's just so helpful to have that accessibility, I would say.
So I'm just trying to envision the technology. So the family, say there's like a circle of care. Does everybody in that circle of care get an update on what's going on with that particular resident?
Exactly. Yep. So as they go through the process of setting up their application, you could add as many people as you like to be involved in that communication. So if staff want to send it to all of the family members or just one that they know might be traveling in, or maybe stopping by, but maybe there's a change or anything like that. So they can communicate one to many or just one to one if they want to.
What I like about this and what I envision, there's so many stories that are told from the caregiver, from the care receiver to the caregiver. And sometimes those stories are not exactly on target, or I'll just go say it may not be true. Well, they haven't fed me in 3 days.
Yep.
Well,
yeah.
that we understand that in most cases doesn't happen, but having this technology helps ease some of those concerns.
Yeah, definitely. And it eases the concerns on the family side to know that their loved one might have attended events. So they get automatic notifications if mom or dad goes to an event, so they know what they're doing. And then also it's a conversation piece for them, right? For dementia care and memory care and Alzheimer's.
Oh yeah.
It's so rough. My grandma actually went through that, and I just saw the progression of that disease and what it does to somebody. So to know that what's happening on a daily basis without calling and getting a rundown or checking in and just seeing that and picking up the phone and saying, "Hey, Mom, I saw you were at poker." Maybe it'll jog her memory to have that conversation. So it's an icebreaker. You know what I mean? And it's just something that's helpful to family members. I hear that you talk about stories. I hear that one time and time again
Right.
from families and caregivers that it's great to have those updates.
And I think if I was looking at this from the perspective of the senior living community, that is a great product to be able to promote to families who are considering that particular community. That's an added plus.
Oh yeah, definitely. Differentiation opposed to the community down the street to say, hey, we have this application. You're looking for updates. You're looking for a way to communicate with us that is 2020, 2021 ways of communicating, right? We all expect instant gratification. If I send you a message, you're going to message back quickly. And our platform helps facilitate that, right?
I want to know right away.
Yeah, exactly. So you're able to see that. And then there's also the compliance part with states changing regulations, changing the documentation on communication, and changing the way communities have to operate. How do you communicate all of that so quickly?
Right.
And our platform helps facilitate that.
I guess that brings me, you mentioned government and messaging, and we're talking about medical records. I'm assuming here, this is probably HIPAA compliant.
Oh, yes, definitely. We take security very seriously. We take for residents, staff, family members, our system is on total lockdown for all of that. It's user permission based. So whoever you want to give access to has access to it, and whoever doesn't does not have access to any of your data. So HIPAA compliance, everything encrypted. You do not have to worry about your data when it's on our platform. So it puts a sense of ease.
You just took the words right out of my mouth. It gave me a sense of ease, right, knowing that, because you face it, there's so many, especially from the caregiver's perspective, you could be juggling raising kids, you've got your parent in the senior living center, you're working, and you've got COVID, and you're trying to get there's only so much information a person can consume in one day. But when you've got that message that could be right there and you can look at it, that could bring some comfort.
Exactly. Yeah. It helps. We always say it brings peace of mind. That there's either a method of communication that you could instantly access, or you're getting that communication from the staff on what's going on, whether it's an announcement or a one-to-one message. So it's just very helpful all around.
So would you, I'm hoping I ask this answer. I can't answer my own questions. So I need a straitjacket, but I'm wondering on this wellness technology. I would consider this a part of wellness technology. Is that?
Yeah, it's wellness when we look at it from the resident side. So
right.
About how do we provide, communities always talk about their wellness program, their life enrichment programming. We help by allowing them to track those wellness programmings over time for different activities and events, and provide the data to say, okay, what events are working and how do you manage those dimensions of wellness as you try to create a robust activities calendar for your older adult. We help facilitate that. And then how do you use that data to build a better program and help keep your residents stay engaged? So it's all built in there with our data engines that we have.
Yeah, and you just, that was the next question that came to my mind. Having residents engaged, the caregiver can see firsthand from these messages that their loved one is engaged in the program and not just sitting in their room. And
exactly. So we have apps for them to look at all of that content. Virtual programming has become a big thing. So our platform allows for embedded videos. Spiral 100 is a fantastic partner of ours. They provide over 100 plus wellness, meditation, and fitness videos. We stream that all through our platform. And then, a big thing for us has been TV channel. We work with cable providers to insert a TV channel. So if residents do go on lockdown or not leaving their rooms, we could provide some sense of normalcy, some programming, and even live stream content directly into residents' rooms. So we try to hit all these different content distribution channels to make sure that however residents want to consume content, we're there to meet their needs.
I have a channel that you might just be interested in that gives a lot of nice podcasts and I might have to refer you to that
You'll have to
that
tell me
popular
more.
Healing Ties podcast.
I heard it's great.
I heard it's yeah. Well, he's just, as they say, a legend in your own mind. I don't know, but no, this is I don't know. This is probably close to my 280th episode of Healing Ties. We're in our
Awesome.
8th season. We're I'm not going to make this all about me, but we've rebooted Healing Ties as we're changing the direction a little bit of the whole care network, and I get the opportunity to meet awesome folks like yourself who are making such a difference in the lives of so many people, and to take it from both the business side and the human side. It's nice to be back.
That's awesome. That's why we love what we do at Caremerge. We make such a significant impact in all these people's lives, older adults, families, staff. It's amazing to see. And it just gets us motivated to get out of bed and do what we do best, is build technology for everyone.
And it's nice to be able to doing something that, has an impact on others. It's a feel good position that you're.
Exactly. That's so true.
Yeah. Well, Josh, this is probably a great time for us to take our break. And like I'm doing with everybody in our 30-30 reboot, I'm asking everybody to think about a fun fact that I'd like to know, and that's definitely our listeners would like to know. So you got to put your thinking cap on, and when we come back, we're gonna reveal that.
Sounds great.
Okay. You're listening to Healing Ties on the Whole Care Network. We will be right back.
Tomorrow on Healing Ties 2.0.
I was reading a journal from 2008. And in it, I had written that I had called her and I said, well, how are you? And she goes, oh, well, she calls me Rick. Rick, I need a colostomy. I was like, you do? Oh my God. She goes, yes, I have to go to the hospital Friday morning and they say I'll be home by lunch. And I'm like, do you mean a colonoscopy? And what she said to me was, oh, Rick, my brain's not working anymore. Hey, my name is Rich Sharf, and I am a long-distance caregiver for my mother who has dementia in a memory care facility in West Virginia, my home state. I hope you can join me and Chris on the Healing Ties podcast to learn more about my story.
Join us tomorrow and every day in November for 30 shows in 30 days. Healing Ties 2.0. Available at thewholecarenetwork.com/Healing Ties and wherever you listen to your favorite podcasts.
Well, welcome back, everybody. I am continuing my delightful conversation with the Vice President of Marketing for Caremerge, Josh Studzinski. I said I was only going to do it one more time, but I just couldn't give up on the first time.
You got it, though.
Did I get? Oh,
you got it.
Very good. So, Josh, it's your time. I'm putting you on the spot. What's that one fun fact about you that you'd like to share with everybody?
Sure. So my senior living career actually didn't begin at Caremerge. It began many years ago. I actually used to speak with my father, Jeff Studzinski, at senior living communities about health and nutrition. He would speak about living your best life. He's a fantastic motivational speaker, and overall, how do you live your best life? And I would come in and speak about health and nutrition since I was a bodybuilder for many years. Yeah, not anymore. Now I'm rocking the dad bod, but it's something that I used to do and be very passionate about. So my dad and I used to go into communities to speak about how do you live your best life? Either it's mind, body, and spirit. And I would talk about the body and how you could stay healthy. So my senior living career began a long time ago with my dad. And I look very fondly on those moments that we had together.
Well, that is a great one to have something like that with your father, and then to be able to get back into the field and really making a difference with seniors and their families. This is just, it's just awesome for you, what you're doing.
Thanks. I appreciate it. It just comes full circle going and doing that when I was younger and doing this now. It just helped me prepare for those conversations that I have now and how we can help our older adults and senior living communities.
And I bet you're ready to start getting back into the communities and doing some presentations.
Absolutely. Working from home over these last couple of months have been nice, seeing the family more, but getting out, visiting the communities and if people get a chance, go to our website. I did a great interview with some of our clients over at Friendship Village of Kalamazoo out in Michigan. I got to speak to the resident staff members, and it's something that I desperately look forward to doing in the near future.
Well, that's something we might be able to help you with, because that's what that's what we're doing too. So it'll be fun.
Good.
Yeah. Well, Josh, we just have a couple of minutes left in the podcast. I certainly want to do more of these with you, but for now, let our listeners know how they can learn more about you and Caremerge. Give out all your contact information.
Sure. So to learn more about Caremerge, you can visit us at caremerge.com or visit us on any social platform you decide to look at. Just search for Caremerge. We are everywhere.
Yes, you are. You are everywhere.
We try to. If you'd like to reach me personally, feel free to email me at josh.studzinski@caremerge.com or ring me up at 708-712-2351.
And that number one more time, please.
708-712-2351.
Josh, with the stories you share and the work that you do, you are certainly someone who's creating healing ties all around us. I can't thank you enough for being with me today.
Thank you. It's been a great session. I appreciate it.
Well, I hate when I have to close these sessions, but that does it for this episode of Healing Ties. As you know, I'm your host, Christopher McClellan. You might know me as the Bowtie Guy, and I've created a life to love after caregiving ends by sharing stories, resources, and being with awesome people like Josh Studzinski. Healing Ties is produced in the posh studios of Odd Box Production in St. Louis, Missouri, and is part of the Whole Care Network. Check out our soft launch of our new Whole Care Network website and be sure to meet Bo, because Bo ties it together on the Whole Care Network. And subscribe to Healing Ties wherever you listen to your favorite podcast. We'll see you for another episode of Healing Ties, tomorrow, as we continue our 30 podcasts in 30 days to celebrate National Family Caregivers Month. Thanks for listening. Take care. Bye for now.
Ciao.
This is WCN, the Whole Care Network. You talk, we listen.